Diagnosis and treatment of depression. Below we mention some of the criteria that are often relied upon to diagnose depression: history of symptoms of depression, where the person is asked about the exact psychological and personal symptoms that he suffers from, and whether he has experienced any changes during the last period of his life, which may return to the emergence of these symptoms. And it should be noted that the diagnosis of depression depends mainly on the symptoms mentioned in the previous paragraph. The diagnosis is made if the patient suffers from 5 or more of the above-mentioned symptoms daily for 2 consecutive weeks, and in addition to that, both low mood and loss of interest must be among these symptoms, and the symptoms he suffers from affect his daily life. Family history of depression. Since depression may be linked to genetic factors, the person is usually asked about any family history of depression. Examinations and tests to rule out other diseases and disorders. The diagnosis of depression is not based on specific laboratory tests. There is no blood test or analysis that can determine whether a person suffers from depression or not. However, the doctor may recommend conducting some tests in order to exclude some diseases and health conditions that can cause symptoms similar to sadness and depression, such as thyroid function tests, as the symptoms of sadness and low mood may be caused by a person suffering from hypothyroidism. Depression treatment depends mainly on the severity of the disease. In the event that low-severity depression is diagnosed, the doctor may recommend waiting for a period of no less than 2 weeks and monitoring whether the patient may improve, and studies have shown the effectiveness of exercise in relieving depression, in addition to resorting to dialogue with a relative. Friends, or specialists about the nature of his feelings can help him get rid of depression, and in the case of low to moderate depression, behavioral therapies and talking therapies are usually recommended, or drug treatments, but in cases of severe depression, more than one type of treatment may be recommended. The following is a list of some of the types of treatments that a doctor may resort to if a person suffers from moderate or severe depression. Pharmacological treatment. There are many types of antidepressants, in English, antidepressants, selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SSRIs, tricyclic antidepressants, and monoamine oxidase inhibitors, MAOIs, and since most of these drugs are similar in effectiveness, the choice of drug treatment for a person with depression depends on other factors such as side effects, injury to the patient with other health disorders, or taking other medications, the patient's personal choices, and the price of the drug, in addition to the patient's previous experiences with antidepressants. Depression, if any, and it should be noted that drug treatments for depression usually require the passage of time to take effect. The patient may begin to improve after 1 to 2 weeks, but full recovery often requires 6 to 12 weeks. Psychotherapy, English, psychotherapy. There are many types of psychotherapy used that have proven effective in treating depression, and these treatments usually depend on the help of a specialist who promotes positive thinking in the sufferer and motivates him to make the necessary changes to relieve depression. In fact, depression usually makes it difficult to live a normal life, but there are many tips that can help to reduce the severity of the impact of depression on the patient's life. A person with depression is advised to talk about the problems he faces, whether it's talking to a friend, relative, professional, or group of people who suffer from depression. Making some changes in sleeping patterns can help, such as turning off electronic devices, doing some relaxing activities, and changing diet, such as eating a lot of fruits, vegetables, fish, olive oil, quitting smoking and alcoholic beverages. And the person with depression must try to control the negative thoughts he faces and try to change them. And it is advised to avoid postponing the daily tasks that he usually does, and try to do them in the usual form and time. And it should be noted the importance of the impact of a person's depression on those around him, from relatives or friends. These people are usually advised to talk about their problems to mitigate this effect, in addition to the importance of following up on a depressed person and paying attention to signs of suicidal ideation, such as talking about death, or that the victim self-harm, and the need not to neglect him, and to consult a specialist as soon as possible if noticed.